It is estimated that 50% of people with a penis aged 40 to 75 have experienced erectile dysfunction. This is the inability to maintain an erection for intercourse. The penis relies on sufficient blood flow to become erect. It is most likely that cardiovascular disorders such as high blood pressure and atherosclerosis can cause erectile dysfunction. At around age 40, most people have an enlargement of the prostate. The prostate wraps around the urethra. So if it becomes too large, it can start to narrow the urethra, causing difficulty urinating. If too extreme, it can cause bladder and kidney damage or completely block urination, which is fatal. Prostate and testicular cancer are common forms of cancer. Both are screened for regularly and can be treated if caught early. Endometriosis occurs when endometrial-like tissue are found outside of the uterus. This is the most common cause of pelvic pain. During the menstrual cycle, the hormonal changes affect these tissues, causing pain at certain points. Sometimes it can be treated with hormonal contraceptives. In severe cases, the tissue is removed surgically, or the entire uterus and ovaries are removed. Ovarian cancer causes about 14,000 deaths per year. Dysmenorrhea is painful menstruation, is the most common menstrual disorder. It is suggested that high levels of prostaglandins that cause uterine contractions may play a role in causing dysmenorrhea. Ovarian cysts are fluid-filled sacs in the ovaries. These can form from a follicle that does not rupture, or from the corpus luteum that does not degenerate properly. Small cysts are not problematic, but larger ones can cause abdominal pain or torsion of the ovary, cutting off its blood supply. Most cysts resolve themselves, some burst, and occasionally some need to be removed surgically. People with polycystic ovarian syndrome have a hormone imbalance that prevents follicular cysts from ovulating. The ovaries build up with many small cysts and can make it difficult to conceive. Infertility is the failure to achieve pregnancy for 1 year of regular unprotected intercourse. Common causes of infertility are low sperm count, abnormal sperm, blocked oviducts due to pelvic inflammatory disease, and endometriosis. Some causes of infertility can be treated with medical intervention. Assistive reproductive technologies are medical techniques that can increase the chance of pregnancy. Artificial insemination involves a physician placing sperm in the vagina or the uterus. The sperm may be from a partner or from a sperm donor. During in vitro fertilization, follicles holding immature oocytes are collected and placed in a lab setting. They are fertilized in a lab and then transferred into the uterus 2 to 4 days later. Embryos can be frozen and stored for later use, and tested for genetic disorders before being used. Gamete intrafallopian transfer is exactly the same as in vitro, except the embryos are placed in the fallopian tubes to travel to the uterus. A surrogate is a person who is contracted to become pregnant by the parents. They will give birth and then give the baby to the parents for an agreed upon compensation. Intracytoplasmic sperm injection is when the sperm cell is directly placed inside the egg using a microscopic needle. This is different from in vitro fertilization, where the sperm are only introduced and must penetrate it on their own.